Well, thanks so much for your interest in the VertiGONE Goggle for the diagnosis and treatment of positional vertigo. Because positional vertigo is the single most common cause of vertigo, after your history and examination is complete, the Hallpike maneuvers are done for the diagnosis of positional vertigo and identification of which ear is causing the positional vertigo. Additionally, we each have some familiarity with the Epley maneuvers for the relief of positional vertigo. Because these diagnostic and treatment head maneuvers are not done often, these maneuvers can be unclear. The VertiGONE Goggle provides an accurate, easy, and effective way to do these maneuvers and cure positional vertigo with confidence. We will demonstrate how the Hallpike maneuvers and the Epley maneuvers are done with the VertiGONE Goggle. The goggle has a goggle body, head strap, and optical unit. The optical unit has two visual indicators. The first visual indicator is a clear plastic sphere containing oil in a bubble called the coach ball. On the outside of the clear sphere are yellow and blue paths. When the patient has the VertiGONE Goggle on and the patient's head is moved such that the bubble moves along the paths, accurate Hallpike and Epley maneuvers will be accomplished. The second visual indicator is a sphere within a sphere, a 360-degree compass called the guide ball. There are 3 guide balls with each VertiGONE Goggle, black, blue, and yellow. When the guide ball is inserted into the optical unit and focused, the patient will see the inner sphere graphics move within an outer sphere graphic as the bubble moves under the lines on the coach ball. This gives the patient confidence and helps the patient stay in each of the positions. Let's see how the goggle is used clinically. The black guide ball is inserted into the optical unit and the door closed and snapped. The unit is placed on the patient's head with the optical unit over the right eye. The black guide ball is focused. Looking at the coach ball, the bubble will be seen to be under the S. Turn the patient's head 45 degrees to the right and have the patient lean back such that the bubble follows the blue path from the S to the numeral 1. Wait in this position for 30 seconds or until any dizziness resolves. Sit the patient up for 30 seconds or until any dizziness resolves. Now turn the patient's head 45 degrees to the left and move the head such that the bubble follows the blue dotted line to the numeral 2. Again, wait in this position for 30 seconds or until the dizziness resolves. Sit the patient up for 30 seconds or until any dizziness resolves. If the patient had no vertigo in either Hallpike position, then the patient's vertigo is not positional vertigo. If the patient was dizzier in the right Dix-Hallpike position, then the patient has right positional vertigo. If the patient was dizzier in the left Dix-Hallpike position, then the patient has left positional vertigo. We will now treat the ear that's causing the positional vertigo. If the right ear is causing the vertigo, the black guide ball is removed from the optical unit and the blue guide ball inserted into the optical unit, the door closed and snapped, and the goggle placed over the patient's right eye. The guide ball is focused. If the left ear is causing the vertigo, the black guide ball is removed from the optical unit and the left guide ball is inserted into the optical unit. The door is closed and snapped and the patient placed over the patient's left eye. We will demonstrate the Epley maneuver for the patient who has right positional vertigo. The guide ball is focused. The patient is seated on the exam table. The head is moved 45 degrees to the right. The patient is laid backward and his head is moved such that the coach ball bubble moves under the blue path to the number 1. Wait in this position until the patient's dizziness resolves. Now keep the patient's chin upward. Turn the patient's head 90 degrees to the left, keeping the bubble under the blue line, stopping at the number 2. Wait in this position for 30 seconds or until the dizziness resolves. Continue to hold the patient's head in the 2 position and instruct the patient to roll onto their left side, putting their left shoulder completely under their body. Now turn the head 90 degrees to the left, following the blue line to the number 3. You will see that this requires that the chin be tucked to the chest. Stay in this position for 30 seconds or until the dizziness resolves. Now keep the patient's head in the 3 position and raise the patient into the sitting position. This will move the bubble along the blue line back to the S position. Keep the patient in this position until the vertigo resolves. Repeat the above maneuver 2 times on the day of the first treatment. The patient is to sleep reclined no more than 45 degrees for 2 nights. You should expect 60 to 75% resolution of symptoms within 36 hours after the first treatment. Ask the patient to return in 1 week and repeat the maneuvers 2 more times. You can expect the patient to get 15 to 20% improvement within 36 hours after the second set of treatments. There may be some remaining imbalance which will resolve over time.